बासित
जी डॉक्टर साहब,
ये उसको डॉक्टर नोबिया को अपना ईमेल सेंड करो, वो प्रेजेंटेशन भेजना चाहती हैं।
ओके
हेलो
जी, मैं कर रहा हूँ।
हाँ
आप डॉक्टर नेजा की बात कर रही हैं?
नहीं, डॉक्टर नोबिया अली
ओके
NICUD से,
जी
उनको अपना ईमेल सेंड करें। डॉक्टर उनेजा तो हैं यहाँ पर वैसे ही हमारे साथ। हेलो हाँ सायरा, हाँ बताओ। हाँ कर रही थी, माइक चेक कर रहे हो?
जी मैंने अनम्यूट नहीं करने दे रहा।
तो मैं उसको बोलूं बासित को? हाँ ये सायरा कह रही है कि मैं अनम्यूट पता नहीं क्या हुआ है या कुछ, उसको आप एक्सेस दे दें सारा बुखारी को। बासित हेलो हाँ
जी डॉक्टर साहब, मैंने उन्हें पोस्ट बना दिया, शी कैन अनम्यूट हरसेल्फ।
अच्छा ये कर सकती हैं आप, ठीक है। हेलो
यस
हाँ ये कह रहे हैं कि आप अनम्यूट कर सकती हैं।
Thank you. Can you hear me now?
ठीक है।
यस
Great. There's still a little bit of feedback. Are you still getting that? Okay, there we go. That sounds better. Great. Now, when I present, will I be able to, can I go ahead and practice sharing my screen?
Just hold on.
Am I the first talk?
भाई बासित खालिदा जवाब दो ना बाहर वाली को।
डॉक्टर खालिदा बताएंगी।
अच्छा प्लीज मुझे, मैं बड़े स्क्रीन पे कैसे जाऊं? यहाँ तो कुछ लिखा ही नहीं है, मैं कैसे वापस जाऊं? भाई साहब
अभी तो जी अभी तो डॉक्टर ने अभी स्क्रीन शेयर जो है ना वो अभी नहीं हुई,
बंद कर दिया है।
जी अभी स्क्रीन शेयर बंद कर दी है।
अच्छा ठीक है,
हाँ ये ऑटोमेटिकली हो जाएगा, जब स्क्रीन शेयर करेंगे तो आप ऑटोमेटिक।
ओके। और जब मैं स्लाइड्स दिखाऊंगी तो मैं वो शेयर कर दूं, है ना?
यस ऑफ कोर्स, आप जो यहाँ पर ग्रीन कलर का बटन है स्क्रीन शेयर,
हाँ
वहां से आप
वो दबा दूं, हाँ दबा दूं,
वो
ठीक है
स्क्रीन शेयर के फिर जो आप स्लाइड दिखाना चाहते हैं उसे आप क्लिक करेंगे।
ठीक है ठीक है ठीक है। और बड़ा स्क्रीन आप खुद कर देंगे अभी?
जी स्क्रीन ऑटोमेटिकली बड़ी हो जाएगी।
ओके ओके।
Would you like, can I just try and share from my screen, from my slides?
Yes you can.
Great. Could the person who's sharing now, could they just stop sharing for a second? Here, hold on a second. Great. Okay, great. Can you see my slide?
Yes.
Great.
Let's see.
Should I just start there because will I be the first presenter in 1 minute?
Dr. Khalda will update.
ये सारा सायरा बुखारी ने ज्वाइन कर लिया है, तो आप उससे कहें कि इसको।
अच्छा मैं अभी करता हूँ पोस्ट करता हूँ। आपने आपका सेल कौन सा है उससे मुझे उसका बताएंगी?
सायरा बुखारी का है ना सेल नंबर आपके पास? मैं उससे कहूँ कि आपके साथ करें बात।
Good morning, Ruth. Good morning.
Good morning. Thank you so much for inviting me to be able to be here.
Oh, it's a pleasure to see you. Pleasure to see you. What time is it in your country?
5:30.
Morning.
Yes.
Wow, what a dedicated, professional, my God. All for Go Red for Women. It's because of Khalida. The lady Khalida is the one behind all this.
Wow, thank you.
It's because of her I found a red shirt. She gets happy. She says you wear red. सारा बुखारी शुरू कर दें?
जी अच्छा जी।
हाँ जी अब।
Bismillahirrahmanirrahim. Assalamu alaikum. I hope you can all hear me.
Yes.
Okay. Yes. So on behalf of Go Red for Women, PCA, Pakistan Cardiac Society and American Heart Association, I would like to welcome you all to our Women and Heart Health virtual symposium. This is a very special month because we are celebrating Go Red for Women month this in February. And we have arranged various symposia to highlight different aspects of women heart health. So without further ado, I will start by introducing our chairpersons, Professor Suhail Aziz Tamgha Imtiaz. He is the president of the Pakistan Cardiac Society, professor of cardiology and medicine, ex-commandment and executive director, ex-advisor cardiology, Pakistan Army, and ex-dean of the Cardiovascular Sciences Army Medical College, NUMS. Our other chairpersons are Professor Khalda Sumro, our very own Dr. Khalda Sumro, who is the CEO and coordinator of the Go Red for Women, PCS AHA Pakistan, chairperson of the Scientific Council of Women with Heart Disease of the PCS, ex-president Pakistan Cardiac Society, ex-vice president Asia Pacific Society Cardiology, and ex-professor and chairperson as well as director of the Cath Lab of the Dow University of Health Sciences, Karachi. Professor Nusrat Majid needs no introduction. She is the co-chairperson for the Go Red for Women, PCS AHA, consultant cardiologist, Be Well Hospital, Islamabad, ex-professor and head of department, cardiology and medicine, Rawalpindi Medical University. Professor Zainab Samad is my mentor. She is the chairperson of the advisory board for Go Red for Women. She is also a professor and chair Department of Medicine at the Aga Khan University Hospital, Karachi. She is a consultant cardiologist at the AKU and a member of the editorial board of the APSC Journal. Our dear Professor Amber Ashraf, again, needs no introduction. She is a professor and HOD of cardiology and Cath Lab director at the Khyber Medical College, Khyber Teaching Hospital, Peshawar. She is the regional coordinator for the Go Red for Women for the KPK chapter. Professor Amber Malik is very well known, of course. She is the regional coordinator for women for Go Red for Women, Lahore chapter. She's an interventional cardiologist, chairperson of the Scientific Council on Peripheral Arterial Disease, PCS, ex-head of department, Sheikh Zayed Hospital, ex-general secretary, Pakistan Interventional Society of Cardiology. And lastly, Dr. Huma Tareen, an up-and-coming bright star. She is the regional coordinator for the Go Red for Women, Balochistan chapter, assistant professor at the Bolan Medical College, Quetta, and she holds the distinction of being the first female cardiologist at Balochistan. I am the moderator of the session. My name is Dr. Sayyida Saira Bukhari, and I'm assistant professor and section head of cardiology at the Aga Khan University Hospital. So we have some housekeeping rules. Each presentation will be 10 minutes. In the interest of time, we will have the question and answer session at the end, followed by the panel discussion. So I will introduce our first speaker, who has woken up very early in the morning for us. Her name is Dr. Ruth Matterson-Kraber. She is from the UK. She is an associate professor of population health sciences and cardiac thoracic surgery, Weill Cornell Medical College, ex-assistant professor of healthcare policy and research, Weill Cornell Medical College. Her topic is use of smartphones for smart heart prevention awareness in women. Dr. Ruth, welcome, and please begin your presentation.
Thank you. Thank you so much for inviting me. It's such an honor for me to be able to join the Pakistan Cardiac Society and American Heart Association to Go Red for Women. So thank you. So today we're going to cover how to use smartphones and digital tools to support heart health among women. Now, among this esteemed panel, I don't really need to give everybody this background slide here, but I think we should start here because this is what it's about today. Cardiovascular disease in Pakistan is a leading cause of death. 1 in 4 adults in Pakistan are living with it. And even though men and women, of course, equally susceptible to developing heart diseases, women are less likely to be diagnosed early. And so we know that gender matters, and this is why a gendered lens is critical across the continuum of care for women. There are some, as we know, there are some sex-specific risk factors for women, including early onset of menstruation, menopause, pregnancy-related complications like preeclampsia, as well as, women with diabetes are at higher risk of dying from cardiovascular disease than men. So what we need to be aware of is the different clinical presentation that women often present with. Oftentimes in the literature, it's referred to as atypical symptoms. Now, I think we need to stop using that term because symptoms that women have are very typical for women. Symptoms like shortness of breath, weakness, fainting, nausea, and non-coronary chest pain are very typical. Finally, women are at higher risk of cardiovascular disease because of delayed access to care. Women often don't recognize these symptoms, their symptoms, as those of heart disease, and so they can be delayed in seeking medical help. They tend to present later to hospitals, and when they present, their illness is more serious, putting them at higher risk of heart failure and mortality. And so once again, this is why a gendered lens on the diagnosis and management across the continuum of care is critical. So here, I want to talk today about how we can use digital tools, specifically smartphones, to be able to address some of those barriers that women have. Before we get into some of the details, though, it's important for us to lay the groundwork here. When we're talking about different types of digital tools, we're talking about tools that can collect data both passively and actively, okay? Passive data collection, it requires no manual input from the user. And this is where health apps, wearables, and different types of implantable medical devices fit. These would be also remote monitoring devices like ICDs and continuous glucose monitors. And then we also have active data collection. And this requires active input from the user. They would include things like patient-reported outcomes, which are outcomes that are collected directly from patients without any intervention or interpretation by a healthcare professional. The types of outcomes that we look at with active data collection include functional status, quality of life, mental and physical health symptoms. Now, all of these patient-reported outcomes can really be useful for healthcare professionals for driving individual level care, researchers for looking at population monitoring, and finally, patients for their own self-management. So digital tools can really be very useful for three different things within healthcare. The first is support transitions of care. The second is to improve communication between patients and healthcare professionals. And the third is to give people more access when they wouldn't have had access before. I think about that in terms of these three different gaps. So I'm going to talk about that first gap. This is the interclinical gap. Smartphones and digital health tools can be very useful for being able to bridge information between the hospital and the home. The vast majority of our effort in healthcare is focused on that hospital or what's taking place in the clinic visits. But we know that 99% of people's time is spent at home. And these tools can really be a bridge for helping to more actively monitor what's taking place when patients are at home. I like this quote from a very esteemed cardiologist in the US. "We do a great job of tuning people up in the hospital, but we have no idea who's coming back and when." We need to close the guesswork by being able to do more close monitoring of patients in that interclinical space. The second gap is this information gap between doctors and their patients. A major challenge here is this asymmetry of information where doctors have the information that patients need. But at the same time, there's a second gap, and using smartphones can really help close both of these. The second gap, though, is that patients are the experts in their own disease or condition. Women with heart disease are the experts in their own symptoms. What are the symptoms that they're experiencing? Is it nausea? Is it shortness of breath? They're really the experts in their own experience of their disease. So once again, the information gap can be closed by being able to be using tools like smartphones. And the third gap is the digital divide. As we know, there is a major divide in terms of who has access to technology and who doesn't. And that's changing very rapidly, though, as the expansion of smartphones grows tremendously. In the United States, it's over 85% of adults own smartphones, and it's probably similar in Pakistan. But these tools can really be a tool for bridging divides because they can close proximity in terms of geography and really help support more vulnerable groups. This was a paper that I was part of from Jack that just was published, where digital tools can really be used to help support older women and their caregivers because of not having to travel for care. And as you can see here, we have this figure where it's really talking about gero technologies. How do we take these tools and make them friendly and have them co-designed with older adults with heart failure? And in this case, we're specifically thinking about women. How can we use these tools to support women, to help identify goals of care, assess their barriers, and then close those barriers with these different types of digital tools? I also led a meta-analysis where we evaluated 4 types of digital tools in a study where we looked at 16 different randomized trials. This was published in the Canadian Journal of Cardiology last year. We looked at all-cause mortality, heart failure hospitalizations, and all-cause hospitalizations, and looked to see if mobile health interventions, cardiac interventions for patients with heart failure, which were delivered using smartphones and different digital health tools, if they actually impacted many of these hard outcomes. And what we found was that mobile health interventions reduced risk of all-cause mortality by 20%. We also found that these mHealth interventions, they've reduced heart failure hospitalizations by 23%. And so this is really important here when we start thinking about the efficacy of these tools, that they really can be used to help reduce deaths and reduce hospitalizations. So this is, let me summarize this section here where we talked about these digital health tools can support and to bridge 3 gaps in care. Digital tools can support transitions of care, improve communication, and close information gaps that we have. The third thing I want to talk about briefly is a study. It's called the iHeart trial. Okay, the iHeart trial was specifically focused on atrial fibrillation. We know that atrial fibrillation is highly prevalent and expected to double in the next 10 years. Treatments for fibrillation include cardioversion. Treatments include ablation and cardioversion, but as we know, recurrence is really high. Recurrence are 20 to 25, 45% after ablation and 40 to 80% after cardioversion. So this study in untreated atrial fibrillation increases people's risk of stroke by 5 times. It increases their risk of myocardial infarction and in subsequently developing heart failure. So it's so important for us to be to treat AFib early. So here is a study that was called the iHeart study. And what it used was an iPhone with a LiveCore device. And we sent patients behavioral interventions using American Heart Association's Life Simple 7 text messages. These were sent 3 times a week for 6 months. The LiveCore is a really interesting intervention, mobile health intervention, and that all you have to do is place 2 fingers on these 2 pads on the back of the phone, and it records an EKG. And it can record normal sinus rhythm, atrial fibrillation, or unclassified. And it's very accurate, it's over 97% accurate for diagnosing atrial fibrillation, for screening atrial fibrillation. And so what we found in this study, the purpose of this study was to evaluate time to detection of AFib, treatment of AFib, and quality of life, and symptom severity. And this was all in patients who had undergone either an ablation or cardioversion. And what we found here, and this study is also a really interesting one in that included both passive data collection, right, by looking directly at EKGs and heart rhythm and recurrence, and also looked at active data collection by asking patients about their symptoms and quality of life and knowledge. And what we found in the study was that recurrent arrhythmias were detected earlier in the intervention. There was also no difference, though, in terms of symptoms between the 2 arms of the study. But one thing that was also interesting, and I did an additional analysis of this, was that the use of digital health tools, it varied over the course of the intervention. And some patients were using a LiveCore over 11 times a week. These were called frequent users. And one of the questions that we had was, what predicts frequent users from infrequent users or less frequent users? And what we found is not surprising. It's really patients with more physical symptoms like atrial fibrillations and PHCs that drive use of these tools. And so this is really important, just for you as cardiologists, when you think about using these tools with your patients, it's really patients are typically going to use these most when they're feeling those physical symptoms. And we know, though, that there's a complex relationship between what patients are feeling and what they're actually experiencing in terms of their heart rhythm, but that is likely to drive their use. And that was true of both moderate users as well. And finally, in closing, I just want to acknowledge my mentor, Dr. Kathleen Hickey. She was the principal investigator of the iHeart trial that was funded by the National Institute of Health. And she passed away last year due to cancer, but she was an amazing cardiovascular scientist and a champion of women's heart health and a huge advocate for Go Red for Women. So I just want to close in remembering and honoring her. And so just in closing again today, to recap, we talked about how the use of smartphones and digital tools to support heart health among women. And now I'd like to close. Thank you so much.
Thank you very much for a very interesting talk and telling us how we can use technology to help our patients. I would now like to invite Professor General Suhail Aziz to give some introductory remarks about this symposium.
Assalamu alaikum, Bismillah ar-Rahman ar-Rahim. It gives me great pleasure to be part of this very wonderful symposium. And I think because some time delays, lots of little difference in how people have been logging in. I'm particularly grateful to Professor Khalda Somro and Dr. Professor Nusrat Ara and host of galaxy of very wonderful speakers and academicians who are in the panel, including Dr. Amber Ashraf, Dr. Amber Malik, Dr. Matareen, and of course, Dr. Ruth Kreber for her wonderful lecture we just heard, Dr. Nobia Ali, Dr. Nabila Somro, Dr. Sair Bukhari, Dr. Sneem, Dr. Huma, and Dr. Aneza, Professor Aneza Niaz. I think we, as President of Pakistan Cardiac Society, really appreciate the good work done by these wonderful leaders in their specialities in promoting women and health. And I'm sure we're going to have some wonderful lectures. We'll cover a lot of subjects which need to be emphasized. And of course, the aim of these sessions is to educate the health providers with the knowledge of where we stand right now. And of course, like the use of the smartphones and how to stay in touch with our patients. So we have to work out modalities on how to educate our health professionals and how to help them educate our society. We know that heart disease is a leading killer in women the world over. And the tragedy is that at least in our part of the world, women tend to be ignored. I see patients who come with a heart disease, they've got a wife with them who has issues. No, she just has diabetes and they haven't had her evaluated. So women tend to be ignored in follow-up in initial evaluation. And for some reason, women tend to present differently also. And at least in our part of the world, we find that women tend to be less physically active. So the breathlessness which they present tends to be very misleading. So these things have to be pointed out. And, it does strike women in little later age groups, especially after menopause. But there's certain features which we see in Pakistan, younger people getting heart disease, including not only just men, but women also. And of course, we know the oral contraceptive pill have the predictor for heart disease, but family history tends to play a very hard part to play in our part of the world. We, as a ethnicity, seem to be the diabetic and hypertensive disease capital of the world. And so I think we need to bring that forward, and we need to educate our women in making them aware that they have to take responsibility for their health. And, and they have to be given different markers. For example, we saw from Framingham that if you have a lower heart rate, you tend to live longer. And, so that applies to women also. So if they have a lower heart rate, we tend not to, be ignored if you tend to have a higher heart rate. We need to make them aware that if you have shortness of breath and chest discomfort or pain or regular in the chest or upper abdomen, heartburns, which we tend to presume are dyspepsias. I mean, I think last year I came across 4 cardiologists who ended up with stents and surgery, actually thought they had heartburns. So even it's such a misleading disease, at least the coronary artery disease, that people tend to really mistake heart disease for heartburns. And so irregular heartbeats have to point it out. And so we need to tell them on how to stay active, how exercise plays such an important role in all of this, how to stay away from smoking. And we tend to think that hookah smoker, which is something like the shisha or the bubbly, tends to be less harmful, but it's not actually. So we need to encourage them how to stay active, how to eat better, how to not overeat, and how to cope with stress. And we need to make them aware that at least get your blood pressure checked, get your sugar levels checked. You need to have all these awareness program going on, and you seem to be on the right path of all this wonderful sessions of lecture going on. By and large, I think the new we talk about an apple a day keeps a doctor away. That works fine unless you have a doctor for a spouse. But I think banana is considered the new apple. It has lots of these very wonderful calcium and potassium in addition to fiber. So it's really a good advice one could give to women and who tend to be actually more focused on the health of the family rather than themselves. Increasing use of citrus for vitamin C, inclusion of these very bright fruits like berries and squash and so forth. Their juices in their diet would go a long way. So I think all these things will be covered by these wonderful speakers. I'd like to once again thank you all for inviting me in this session, and I wish you well and a great session, which I'm sure it will be. So without any further ado, I'd let the other speakers take over. And thank you again and welcome to the session. And it's been a great pleasure listening to the first talk. And I'm looking forward to the other talks in the session also. Thank you very much.
Thank you very much, sir, for your very interesting comments and letting us know that banana is the new apple. So thank you very much for that. I believe Professor Bilal Muhyiddin wants to say a few words as well.
Dr. Bilal, please unmute yourself.
Thank you. Assalamu alaikum all. Thank you all for giving me this opportunity to be with you. Indeed, this is a great moment. And when you have such brilliant talks coming out from such beautiful looking speakers, it becomes even more exciting to listen to all of that thing. And talking of this devil, which we call the mobile, and trying to make it a friendly device is something that we all really need to look into. My 2 cents that I would like to just put in is that GoRed has got a lot of targets to meet. And indeed, it is the targets that are there that have to be met. We cannot just leave it over there because Ruth, you will be interested to learn this, that in our part of the world, whenever we ask a lady, what do you do for a living? They unfortunately turn around and simply say that I'm just a housewife. Now, just the whole idioticness of this thing is that, number one, they use the word just, and number two, as if housewife is something, derogatory. And yes, you may call it derogatory because in our part of the world, a woman is referred to as the mother, the sisters, or the people who actually make the homes. So for us now, the new term over here is that they are the homemakers, the ones who actually built the home. Now, the reality behind this whole part is that when they are in the process of building the homes, and like every good general, they always sort of, let the soldiers get the best. So they are always trying to give the best possible to their families, and they sort of look down on themselves. And it is that whole thing that when they're eating the leftovers, when they are not doing the exercises which they are supposed to do, when their pregnancies have not been looked after the way they were supposed to be done, And it is all those little things that finally get up, and as the age advances, it sort of catches on into you. So Go Red needs to go into many directions. I've seen their fantastic program, and hopefully I'll be listening to all your talks, and we have got a fantastic session coming up next month in our area called Sakhar, where the Go Red is holding another fantastic meeting, which is covering most of these important subjects. So all I'll simply say is, Professor Khalda, Professor Nusrat, you are leading this whole concept, the team, into a place where actually you need a lot of things. And one of the basic things that we need to actually start looking into it and accepting is that in generality, when we look at our patient population inside the hospitals, we normally see a disparity, that normally there are 2 to 3 male beds, and then there is 1 female bed. And thus the source of admission, the placement of the beds becomes a difficulty, because we have these gender limited beds available. So 1-to-1 needs to be done, and that is the place where I'm sure you all are working on it. I've tried to do that in my unit, and I'm sure you're trying to do that all in your units. And this is a message that sort of needs to go out to public health officials also, that we are moving in that direction. Because at the end of the day, unless the women of the society are healthy, we will not be able to have a strong and a healthy country. And unless the mothers are good, the sons will not be good. So once again, thank you, and hope we just continue on with these strong events that we have. And thank you all for being a part of it. And let us educate our mothers and young girls coming up from tomorrow, so that they can be better doctors and better mothers. Thank you.
Thank you very much, Dr. Bilal, for describing the social and health inequities that Pakistani women face. Without further ado, I would now like to introduce Dr. Uneza Niaz. She is an adjunct professor of behavioral sciences and psychiatry at the University Health Sciences, Lahore. She's a faculty of psychiatry at the Dow University, Karachi. She is a WFMH director at large, president of the Pakistan Society for Traumatic Stress Studies, founder chair section on women's health, mental health, the World Psychiatric Foundation, founder and advisory council member, International Association Women's Health, Mental Health, advisory international editorial board member, Lancet Psychiatry. Her topic is a very interesting and important one: stay away from sadness for a healthy heart. Welcome, Dr. Uneza Niaz.
I feel very privileged and in fact grateful to Dr. Khalda, who actually invited me. And I'm, very lucky to have met all the senior cardiologists and both the men and women cardiologists of the country, and Ruth from my second home, England, a young cardiologist. So it's a great pleasure, and I hope when I have a problem, they take care of me. I just wanted to say that pain and pleasure is part of life. We cannot separate sadness. We cannot separate sorrows and things like that. The only thing we can do is that if we have knowledge and we know how to prevent these cardiac events, and we take care of the people who do get these problems, the quality of life will improve. I mean, death is inevitable. We all will die. But living a sick life is the most miserable thing. And on top of that, when you have these conditions, the cardiac conditions, sadness and depression is definitely part of it. I'd now like to share my slides. Okay. Why can't I have my slides? Share. I can't share my slides.
Has the previous speaker's slides been taken off?
No, yes.
Here we are. Here we are.
Yeah, you've got it. You've got it. Now, what has sadness to do with heart disease? Now, we should know the fact about mind and body connection. Research data has shown that stress may impact health, but it is not may, I think definitely impacts health.
Sorry, you need to go to slideshow, please. Press the
I
slideshow
haven't got
button.
it. Isn't it on?
No, you need to press the slideshow because we're just seeing all the slides over here.
Are you
Press the
seeing mine
slideshow.
now?
Yeah,
Can
we
you
are
see
seeing
it?
yours, but press the slideshow. Press the slideshow.
Well, in mine,
Bottom
there's
right.
only new share. There's only new share.
Okay,
I
please
think-
go.
Dr. Mehmet, on this presentation, on the right side, you got the button of slideshow. Just press that button. We are already viewing your slides, but all the slides are visible. Just press the slideshow button on the presentation.
On
At
the
your
presentation.
yes. On the
Okay.
right bottom corner,
It
there is
looks like
slide
a
button.
screen.
Can you
It
see
looks
it
like
now?
a screen.
We,
Yes, we can, but
we screen your screen. Right at the bottom, right, you will see there's a word written notes, and then there's written comments. Then it is the current mode on the right hand side. Come, take your pointer to the right hand side. Go down.
Yeah.
Go down.
Go down. Okay.
Bring your pointer down. Bring your pointer down. Do you see a word notes and comments written?
Notes and click only.
Yeah, and over. No, you are on the left side. You need to go to the right side.
There
I
is
will
nothing
suggest.
like.
Okay, just keep on going. We'll keep seeing all of these. No issue.
Dr.
Keep on
Neza,
going.
please continue. Dr. Neza, we can see your slides. Please continue.
GG. Okay. And I think why I'm presenting this, because being a female psychiatrist, most of the women in even doctors didn't know that there was a very close connection of mind and body. I mean, we knew about the close connection, but we didn't know that it had to do with the heart problems also, that women can equally have heart diseases. Heart disease is #1 killer of women in United States, claiming more, which is said to be claiming more lives than other forms of cancer combined. So we talk of breast cancer, we talked of all sorts of female cancers, we forget heart disease. But the most worrying fact is that when women have a problem, they do not receive CPR by the bystanders, stand-ups, for example, because the rescuers often feel fear of accusation, inappropriate touching, sexual assault, or injuring the victim. This is very common, especially in our part of the world. And then women also, in general, why it is not well known, that wasn't well known, it's becoming well known now, and I think GoRed has done a lot of awareness in this context. But because women were underrepresented in STEM, that is science, technology, and engineering, so they were not in the research, and obviously the women-related researchers were not there. And in fact, women occupy nearly half of all the US jobs, but only 27% of jobs in STEM fields. In Pakistan, it is even less. And only 38% of the participants in the clinical cardiovascular trials are women. So obviously, if you're not going to have trials, you wouldn't know about the women's problems. Then, the interesting thing is that in addition to heart disease, if the woman gets depressed, or even a man gets depressed, the prognosis is dramatically affected. And conversely, people who are diagnosed with heart disease have an increased risk of developing depression. I know my father died of coronary heart disease. My husband had stents, and I know how depressed they were, especially men. But we women who were their wives and daughters also went through a phase of depression. And the prevalence of depression among cardiac patients ranges from 20 to 30%. And this is the latest research in 2017. Now, how does depression cause cardiovascular disease? If in depression, anxiety, stress, your heart rate and blood pressure rise, there's a reduced blood flow to the heart. And the body produces high levels of cortisol and stress hormone over time, and these effects can lead to heart disease. Okay. Now, sorry. And the hypothesized biological causal link between depression and heart disease is based on the deleterious effect that stress hormones have on the cardiovascular system. During normal stress situations, the body will release adrenaline and cortisol, which is good for us for a short time. But in the long term, the higher the normal levels of cortisol, which are found in patients with depression, have adverse psychological effects. In fact, I did this research at the Royal Free Hospital when I was in London as a senior registrar, and almost all my depressed patients had high levels of cortisol. Increased cortisol levels in depressed patients lead to resistance to insulin and increased visceral fat, which might partially explain why major depression can be considered as a risk factor to cardiovascular disease. Now, heart disease affects mental health. We know that. We feel, as I said, when the person or the family where this thing has happened, it causes feelings of depression, anxiety, especially the patients feel very isolated and diminished self-esteem, especially men working at the top of their organization. Suddenly they have to take rest or be number two or take a sabbatical or something like that. And that causes depression. And even in women, now women are head of departments and they feel terrible because they worked so hard to reach that position and suddenly they end up having heart attack. In fact, according to NIMH, up to 65% of coronary disease patients with a history of heart attack experience various forms of depression. It could be reactive depression or it could be endogenous depression, which is pretty bad. And I'm not going to go into details. I'm sure you're all clinicians and you will know about it. You can read it on internet. You can read, maybe next time you have a symposium where we can talk about different kind of depressions, etc. Now, up to 40% of heart patients meet the criteria, heart disease patients meet the criteria for major depressive disorder, and that is endogenous depression also. 20 to 30% may exhibit minor depression and elevated depressive symptoms. This is fairly common. Does depression damage the brain? Now, this is a very important slide. So we are not psychiatrists, talking of the Freudian things, mumbo jumbo, patient lying on the couch. We have become very scientific. Growing evidence that several parts of brain shrink in people with depression, actually shrinks. Specifically, these areas, the areas of the brain which are affected, I'll tell you later about them, they lose gray matter volume. And that's the tissue with a lot of brain cells. That is, gray matter has a lot of brain cells. And it seems to be the higher in people who have regular or ongoing depression with serious symptoms. Again, this is the research which was done in 2020, very recently. It is important to be aware of the head-heart connection. Newer research shows that biological and chemical factors trigger mental health problems. Now, again, we are very scientific. If the PET scans have actually helped us. A PET scan can compare brain activity during periods of depression, and that is left. There you can see there's not much activity, with normal brain activity, which is on the right. An increase of blue and green colors, along with decreased white and yellow areas, shows decreased brain activity due to depression. Also, it is said that brain gets inflamed. And therefore, at one time, people said that depression, especially in spring, often there was a lot of research, and they said flu, for example, all the colds, etc. After a bad attack of flu in the olden days, now we have COVID, etc. And sorry. Okay.
Please mute.
Okay. People who have major depressive episode have higher levels of translocator proteins. These are chemicals linked to brain information. And studies show that these proteins are even higher in people who have untreated major disorder for almost 10 years or longer. So if somebody has mild, low-grade depression, is very altruistic and very religious, people say, oh, well, this is life, and etc., and they're very religious and they believe that this is part of suffering which all human beings have to go through, and they do not go to doctors or do not talk about it. They're the ones who end up having lots of problems, even neurological problems and memory problems. And their depression their personality is affected, their cognition is affected, their relationship with the family is affected. And uncontrolled brain inflammation can kill brain cells, prevent new brain cells from growing, cause thinking problem, as I said, cognition, and speed up brain aging. Alzheimer's is more in these people. heart disease and depression is a two-way relationship. And the prevalence of depression among the cardiac patients, I said, it's fairly high. It's 20 to 30%. Brain size is affected, especially areas lose gray matter volume. Brain tissue has a lot of gray. We've already talked about it. I think I'll go to the second one. Now, studies show that hippocampus is one of the most interesting area of the brain, which has been studied in neurosciences departments, especially with PET scans. That part of the brain is important for learning and memory. It connects to the other parts of your brain that control emotion and is responsive to stress hormones, and that makes it vulnerable to depression. Hippocampus is that part of the brain which is important. Well, this is all the repetition, sorry. And then let's go to the other one. Now, results are mixed on how depression affects amygdala. Amygdala is, sorry, this is very, amygdala is the fear center. Some studies show that it gets smaller. Others found that stress and depression might boost the gray matter volume and lead to more severe depression. More severe depression.
Dr. Oneza, maybe request you to conclude, please.
Yeah, I will. So what I'm saying is that there are all brain effects which are physiological too. I won't go into details. There were lots of studies. I won't go. There's so much in this much time. I can't go into more and more things. So to really conclude, simple treatments are there. Of course, some common treatments which you cardiologists always tell people to take care of to prevent heart disease. But we psychiatrists can treat them with psychotherapy and of course medications like fluoxetine, paroxetine, and sertraline. They are safe in heart patients. In fact, most of the patients who have acute heart attack or coronary artery disease, I often give sertraline or fluoxetine. And of course, there are lots of lovely quotes from Rumi, which is very, very related to religion and spirituality. I think being very altruistic and being religious also helps. Faith is a great help. Friends, family circle, exercise, hobbies, music, art, etc., philanthropic work, and most of all, a sense of humor. And I do feel that if women, but it is very difficult, as somebody said, if there's a happy mother, there'll be a happy son and a successful son if a successful mother is there. But I think we have never thought of ourselves as human beings, or we were like table or chair, or we were like, machines which produced these children and took care of the men. But now we realize we are human beings and very important. We are the hinges, the pivot on which the whole family lies. And so we must take care of each other. And I think hats off to all the Go Red women and all the men who are also included in it. And I'm very, very proud and thankful that you asked me to come. It was a very short time. I'd love to give you some stories next time. Thank you so much.
Thank you very much for showing us the connection between mental stress and heart disease. Thank you very much for your sharing your experiences. I would now like to invite Professor Nabila Sumro. Professor Nabila Sumro is the first female physiatrist with an FCPS gold medal in physical medicine and rehab from the CPSP in 2003. She established the first civilian multidisciplinary rehab institute service at the Institute of Physical Medicine and Rehab at the Dow University of Health Sciences, the first cardiopulmonary resuscitation rehabilitation services at NICVD, and the first multidisciplinary autism unit in Pakistan. She is the president of the PFP MR, president of the PSNR, and the secretary and faculty of physical medicine and rehab at the CPSP, along with as advisory board member of the JPMA and peer reviewer of JCPSP and JPMA. Her topic is a very interesting one. It is heart aid in primary class curriculum. Professor Nabila, may I request you to share your slides, please?
Is she still with us, or she has lost her contact, her Wi-Fi link for some reason? So we can actually go to the next speaker in the meanwhile.
Yeah.
Thank you, sir. I believe she is with us. Maybe she's having trouble unmuting herself.
Hello everybody. Sorry I couldn't connect before. I was there, but there was issue in the mic. So should we?
Can you start the video? Video and the.
Okay, we'll just start. I think there's a little lag behind.
Yes, madam, we can see you.
Okay. Assalamu alaikum to everybody. Thank you for giving me this opportunity to be with you all. And today I'll be just focusing on risk factors, current risk factors, latest risk factors, which we are heading towards our females, our kids, everyone. So since it was about school children, and I was asked that what should we be doing to prevent our latest risk factors. So I hope you can all see that these are the latest risk factors, because I'm part of cardiopulmonary rehab internationally. So these were the latest risk factors which came into being in 2019. So physical inactivity, your nutrition, your stress, and they said if you take care of these three, then your blood pressure, cholesterol, sugar, and waist size, everything will be taken care of. So I'll be quick. I know I have 10 minutes. So I think first I said I better take physical inactivity. Your health revolves around physical inactivity. So am I audible, and can you see my slides clearly? I just want a little.
Yes,
Perfect.
we can see it. Can somebody put this on slideshow, please?
Okay.
She has to do it herself.
I think I've already done it. That's
All
why I
right,
was
thank you.
double checking whether we can just. So
Yes, madam, please proceed. Please proceed.
thank you. So I don't know what is health. So now the health is like not only physical, it's mental, social, and it's not merely being the absence of disease. So cardiovascular health, since our topic revolves around cardiovascular health today. So it refers to the health of heart and your blood vessels. हम बहुत डिफरेंशिएट ही नहीं कर पाते हैं कि जी आप जब मैं काउंसिल करती हूँ अपने पेशेंट्स को तो पता ही नहीं चलता कहते जी हम तो फिजिकली फिट हैं हम घूमते हैं फिरते हैं राउंड भी लेते हैं सारा काम काज करते हैं नो बट दे आर नॉट डूइंग इफ देयर फिजिकल फिटनेस इज नॉट कि आप सिर्फ अपने एक्टिविटी एडीएल्स आर एक्टिविटीज ऑफ डेली लिविंग एंड यू कैन डू दैट बट यू हैव टू डू a continuous exercise without fatigue. So exercise is a planned, structures and repetitive physical activities. It's not कि हम अगर daily जो भी हम घूम फिर रहे होते हैं जब मर्जी है बैठ गए जब मर्जी है उठ गए. So that's not. और exercises के different types हैं. Depending upon age and condition, one can take any exercise जो आपको suit करती है. अब जो एक international standards बना दिया है कि at least 30 minutes of daily walking, or as you can see my watch, or you can monitor your steps through your cell phone or through your these fitness watches, that at least 10,000 steps per day is a minimum requirement to keep your heart healthy and keep you going. So हमारे पास 90% time hot weather है, so सिर्फ इतना देखना पड़ेगा एक्सरसाइज के बाद कि आपका बॉडी टेम्परेचर मैक्सिमम 37 हो, अवॉइड एयर पोल्यूशन, मेंटेन सी कि आप एयर क्वालिटी कौन सी ब्रीथ कर रहे हैं व्हिच इज नॉट रियली इन आवर हैंड, ह्यूमिडिटी शुड बी बिलो 40, कॉटन के कपड़े हो, वार्म अप और कूल डाउन जरूर हो, बट एट द सेम टाइम यू शुड जस्ट लुक फॉर क्रैम्प्स, फटीग, nausea, disorientation, and of course बहुत से लोग ड्रिंकिंग वाटर भूल जाते हैं कि एटलीस्ट 250 ml बिफोर एंड 250 ml एवरी 20 मिनट्स ऑफ एक्सरसाइज। ये एक फिट प्रिंसिपल है इंटरनेशनली विच एवरीवन फॉलोज कि फ्रीक्वेंसी क्या हो, इंटेंसिटी क्या हो, टाइप क्या हो और टाइम क्या हो। फ्रीक्वेंसी तो एटलीस्ट 5 days a week हो। अगर आप 5 days a week नहीं कर रहे हैं तो फिर आप 3 days तो मिनिमम। अच्छा, फिजिकली इनएक्टिव इंटरनेशनली किनको डिस्क्राइब किया गया है? उन लोगों को जो लेस देन 150 मिनट्स ऑफ मॉडरेट या विगरस एक्टिविटी नहीं कर रहे हैं पर वीक। सो इफ वी असेस आवरसेल्व्स, तो हमें पता चल जाएगा कि अगर हम इक्का दुक्का याद करके वीक में एक आध दफा वॉक कर लेते हैं तो दैट विल नॉट मेक अस फिजिकली एक्टिव। सो एटलीस्ट 150 मिनट्स इज अ मिनिमम। जिस तरह मैं कह रही हूँ 10,000 steps per day is a minimum, इस तरह 150 minutes, more than 150 minutes a week of vigorous or moderate which lead to the cardiovascular benefits. Intensity आप कर सकते हैं कि एटलीस्ट 5 नहीं तो 3 days, और मॉडरेट टू विगरस जरूर रखें। लाइट एक्सरसाइज इज ओनली फॉर एंड्योरेंस, विगरस या मॉडरेट आपकी कार्डियोवास्कुलर हेल्थ को अफेक्ट करेगी।
Madam, can you move your slides?
जी,
We can't see your next slide.
you can you see the exercise in hot weather?
No, we cannot.
Oh, you cannot? Okay, so kindly just let me know as soon as my screen sharing is off.
No, your screen share is there, but we are still on the same slide.
Same slide means?
What is healthy? What is cardiovascular health?
Okay.
So just stop share and then screen share again.
Okay.
Yes,
Can you
Madam, we
see?
can see. Yes, we
Okay.
can. Thank you.
Okay, so these are some tips for exercising in hot weather. Since I've already shared, so we'll move on to the next slide. So this is a famous fit principle for everyone who wants to start exercises or is already exercising. कि आप frequency भी बढ़ाते जाएंगे, intensity भी बढ़ाते जाएंगे, type of exercise should also vary, और time भी at least 40 minutes is minimum. क्योंकि 30 minutes of exercise and you can just add 5 minutes of warm up and cool down. तो और endurance exercise separate है, और cardiovascular health के लिए it's very important that vigorous या moderate हो। मैं आपको बहुत simple formula बता दूंगी, अभी बताना चाहूंगी। I'll take extra minute, it's not in the slide. is 220 minus age. जो नंबर आएगा 220 minus age के बाद उसका आप 50% ले लें। उस 50% का जो नंबर होगा वो आपकी पल्स रेट होनी चाहिए टू स्टार्ट एक्सरसाइजिंग, और फिर आप उसको 50% से 60, 65, 85 मैक्सिमम हार्ट रेट पे ले जाएं फॉर योर फिजिकल एक्टिविटी, फॉर योर विगरस फिजिकल एक्टिविटी। ओके, आजकल रेजिस्टेंस ट्रेनिंग का बहुत इंपॉर्टेंट रोल है। एज वी एज आवर मसल्स वेस्ट, और जितने मसल्स डेवलप होंगे और आप रेजिस्टेंस ट्रेनिंग करेंगे उतना ही आपको आपके मसल्स डेवलप होंगे, यू विल बी एबल टू बर्न मोर कैलोरीज एंड यू विल बी मोर फिजिकली एक्टिव एंड इट विल हैव मोर इफेक्ट ऑन योर कार्डियोवास्कुलर हेल्थ। ये मैंने सिर्फ क्लासिफिकेशन इसलिए निकाली है कि इंटरनेशनल, दिस इज इंटरनेशनल फॉर्म फॉर योर क्लासिफिकेशन कैटेगरीज हैं ये। सो आईपैक क्लासिफिकेशन कैटेगरीज है कि हर इंसान अपने आप को खुद गैस कर सके कि मैं लो कैटेगरी में हूँ, मैं मॉडरेट कैटेगरी में हूँ, या मैं हाई हार्ट की फिटनेस कैटेगरी में हूँ। सो आई लीव इट अप टू यू कि आप लोग आज जिस वक्त भी आपको वक्त मिले आप खुद अपना गैस कर सकते हैं कि आप कहाँ, where we stand. And this is International Physical Activity Questionnaire. So इस questionnaire के through आप अपने आप को कहाँ पाते हैं? And this thing should be implemented in schools also. मैं तो अब primary पे बहुत ही rehab point of view से मेरी नजर है, इसलिए कि बच्चे दिन ब दिन physically inactive हो रहे हैं, खाना उनका ठीक नहीं है, stress उनके पास ज्यादा है, obesity बढ़ रही है. So we are seeing atherosclerotic changes in children as young as a year old or even newborn. जिनके mothers healthy diet नहीं खा रही है, and they are not healthy. So 2019 की जब हमारी conference हुई थी, तो this was raised कि rehab people should also open up their eyes at school level. अब मैं nutrition पे आऊंगी. This was this was released in 2019 when we all met together कि एक पब्लिक सेक्टर के लिए क्या एक बुकलेट निकालनी चाहिए जो आम आदमी आम लैंग्वेज में समझ सके और हमारे फ्यूचर जनरेशंस को प्रिवेंट कर सके. सो ये एक इंटरनेशनल प्लेट बनाई कि भाई जो भी खाओ उसका आधा प्लेट का, एक तो प्लेट अमेरिकन साइज नहीं हो, हमारी पाकिस्तानी साइज हो. अमेरिकन साइज प्लेट इज ह्यूज. उसका हाफ शुड बी वेजीज एंड फ्रूट, 1/4 शुड बी होल व्हीट. होल व्हीट मीन्स के ब्राउन वाला आटा और ब्राउन चावल. आई मीन नॉट सफेद चावल जो हम अपने डेली डाइट में खा रहे हैं. और जो 1/4 है दैट शुड बी ईदर पल्सेस, फिश और चिकन. मीट आप ले सकते हैं ऑफ एंड ऑन अगर कभी दिल करे. तो यूएचएन के साथ मिलकर टोरंटो वी एज अ टीम फॉर्मुलेटेड, दे लॉन्च्ड ऑन द वेबसाइट और मैंने इसको अपने लैंग्वेज में चेंज किया, अपना कल्चरल फ्रेंडली किया कि कौन सा तेल यूज करें, कितना पानी दिन में पिए, क्या क्या ग़िज़ाएं कितनी खा सकते हैं, कितनी नहीं खा सकते. Because I have 10 minutes, so I won't go into detail, but slides are self-explanatory. So my second risk factor was nutritional counseling, जिसपे we should all lay a lot of emphasis. This we also practice in our cardiovascular, cardiopulmonary rehab sessions also. So we screen them for all their risk factors and then we talk to them. Okay, first we talk to them about their physical activity, then we bring them to nutrition. So nutrition में जो बहुत famous आजकल world famous diets हैं, वो DASH diet है और Mediterranean diet है, which is based on fruits, vegetable, whole grains, lean meats, जिसमें चर्बी ना हो. अगर गोश्त खाना ही है तो बगैर चर्बी के हो. Fish, nuts, legumes, low fat dairy, and sodium. Yes, sodium should not be consumed for more than 100 millimole per day. 1 tablespoon से ज़्यादा किसी को भी sodium allowed नहीं है. लेकिन in our culture, in Asia, they saw कि we are topping up our food with achar, chutney, sauces, which adds to many millimoles unnecessarily. So low sodium diet. So DASH diet is like, it's named DASH diet. It's dietary approaches for stopping hypertension. Mediterranean diet इसलिए कि उन्होंने देखा people Mediterranean origin में किस तरह they're eating healthy and they have less cardiovascular events.
Madam, may I ask you to conclude, please?
Ji. Stress is third, which I'm just sharing these with you so that you can just smoking. You can self-analyze at school level and at any level for cardiovascular risk factors. Sleep का मैं सिर्फ 1 minute लूँगी. Now 2019 में sleep was the biggest risk factor for cardiovascular. People sleeping in prime time for less than 5 hours and more than 10 hours were sleep was an independent risk factor. Sleep and sleep apnea. Then smoking. बच्चों में, बड़ों में गुटखा smoking और बहुत highest पाया गया. So I'm just sharing those risk factors which we practice in our cardiopulmonary rehab. Blood pressure, I don't need to talk about. You all know. High cholesterol, blood glucose, waist size. It was decided that In Asia, waist size more than 32 inches is an independent cardiovascular risk factor for females and 36 for males. These are all international Lancet journals, which, you know, I've just put in just to put a stamp on what I'm saying and what we've been working on. So thank you so much. With this, I conclude my talk. Thank you for your patience.
Thank you, madam. That was an excellent and very comprehensive talk. I would now like to invite Ms. Tasmeen Ali. I hope I got the name correct. She's an MSc in Nutrition, College of Home Economics, Pakistan, AADE trained level 2 diabetes educator, CDR certified registered dietitian nutritionist RDN, consultant nutritionist Butch International Hospital, Multan, and the chapter head Pakistan Nutrition and Dietetics Society, PNDS, Lahore. Her topic is friendly food for a healthy heart.
Assalamu alaikum. Assalamu alaikum. Can you all hear me?
Walaikum assalam. Yes, we can.
Give me a second to start sharing my slides. Give me a second. Can you all see my slides?
Not yet.
Not yet? Okay, give me a second. Is it fine?
We can see your slides up screen, slideshow.
Slideshow. Okay, I'm putting it on slideshow.
Great.
Okay. Assalamu alaikum. Nice to hear such wonderful talks. Thank you very much for inviting. You all know me. I'm my introduction. I'm Tasneem Ali, and today the topic which was assigned to me was friendly food for healthy heart. And you know, I was thinking vice versa. We need healthy foods for friendly hearts. So but it's okay. Just a small vision which I have a perception. Actually, the objective of my talk today is just to know how we can, what lifestyle modifications we need in order to prevent or treat heart disease, other than smoking and family history. We all know there are the poor diet or basically the three factors: hypertension, dyslipidemia, and diabetes. I feel that they are three major partners in crime to develop heart disease. And we need to make sure that either we prevent them or we control all these three factors: hypertension, dyslipidemia, and diabetes. We need to eat well, and we need to stay on our ideal body weight or close to our ideal body weight. And we need to limit our salt and fat intake in order to achieve all these targets. Talking about medical nutrition therapy for hypertension, we all know Dr. Nabila just spoke about it very well as well. The control of the limited amount of salt we need per day. 2 grams sodium tight, we all know it's a standard that is less than a teaspoon. This is a teaspoon, so it should be less than a teaspoon per day. But AHA's recent guidelines are suggesting to limit it more, like 1500 milligrams sodium per day or up to 1000 milligrams. So it was almost like half teaspoon a day. So a pinch of salt in the morning, a pinch of salt in the lunch, and a pinch of salt in the afternoon is more than enough. We don't need more than that. Usually for hypertensive patients, I usually recommend them for their families, not to add salt in their food. Salt doesn't need much cooking. So if you take out their food before adding the salt into the meal or the curry or the salan, whatever we are making, and let the patient add the salt by themselves, so we can control the amount of salt in the food. Because if there are more serving of food is consumed, then salt intake will be more. And the second major factor for controlling your weight and preventing hypertension and ultimately heart disease is the limiting the amount of saturated fat in the diet. Saturated fat, I'm going to just talk about different types in the next slide. If a person is consuming 2000 calories a day, so less than 10% should be coming from the saturated fat. Saturated fat means butter, cream, full cream milk, and it also in the attached to the is a part of the meat also. The saturated or the desi ghee, which is very commonly consumed, especially in our villages, village side. So saturated fat should be less than 2000 calories. Less than 10%. 10% of the 2000 calorie diet is almost 200 calories. So this tablespoon of, which is 1500 ml, it is almost 150 calories. So desi ghee or makhan or butter, if it's consumed, it shouldn't be around this much a day. It should not be more than a day. We do not need to remove it or exclude it from the diet, but we need to limit the amount. And AHA's recent recommendations for the patients who are already suffering from heart disease, their 6%, less than 6% calories should be coming from saturated fat. So it's furthermore like half a tablespoon a day. So we need to keep these things in mind while suggesting the persons with a heart disease how much amount of saturated fat they should be having in their diet. There are different types, as I was already talking about it, that butter and the gravies made with desi ghee and stuff, cream sauce and non-dairy creamers, especially the hydrogenated margarines, and coconut oil is very high in saturated fat. And I'll talk about it, coconut oil, in the later slides as well. But the suggested unsaturated, monounsaturated fatty acids and polyunsaturated fatty acids are high in canola oil, olive oil, other vegetable oils, and trans-free margarines and nuts and avocados. We don't have much available in Pakistan, but nuts and seeds are a good source of monounsaturated fatty acids and polyunsaturated fatty acids, which are heart healthy. So we need to focus more on these kind of fats other than butter and desi ghee and stuff. Saturated fat is the big source is the meat or chicken. So we need to make sure that we remove the extra fat from the meat or chicken, make it a lean form, and low fat dairy should be consumed. When we are talking about low fat dairy, it's very easy, like especially if we are consuming loose milk, which we usually get from gawalas or cow's milk directly from the person who is selling it. Then even if you boil it twice, you boil it once, you remove the cream, you boil it twice, second time, and then remove the cream when it's cold, that's almost skim. So we can do it at home. And also the low fat dairy is also available in the form of packaged milk in the market. And legumes and lean ground meat, the eggs, they are good sources of protein, which are not in not high in saturated fat. On the other hand, talking about a younger generation, our school going kids, we know every day TV, we can see the marketing and advertising of the hot dogs and sausages and bolognas and pepperoni. They are very high in saturated fat. Occasionally it's fine because we are living in a society and kids have peer pressure as well. So it's okay to consume it once in a while, but giving it to them in the lunch boxes every day is not a good idea. So we should limit it to once or twice a week, not more than that. I mentioned that other than limiting salt and fat intake, obesity is one of the major factors. So calorie deficit, reducing the energy intake. If there is not much physical activity, or even if there is physical activity, one of the studies has shown in the past that when we were surveyed, obese people were surveyed, that what was the reason of the obesity. So the top reason was unawareness of the amount of kilocalories consumed. People don't know how much calories they are consuming. When we ask them what do we eat, they say we don't eat anything, like one roti in the morning, one roti in the afternoon, but they don't they underestimate the amount of oil in the salan they have, the tari they have on the top. So international recommendation for fruits and vegetable intake is right now, it's 9 a day. So 9 cups a day. This is like a 250 ml a cup, and this cup raw vegetables or 4.5 cup of cooked vegetables, they have to be in the diet. It can be fruits and vegetables provide us with all the vitamins, minerals, and fiber we need. Whole grain fiber, whole grain sources are good sources of fiber, and other nutrients play a very pivotal role in it. Protein should not be, animal protein should not be too much. This lady's palm size, it's almost 100 grams. This is enough for a day. Lady's palm size amount is a deck of cards. It's enough for a day. We don't need more than that. So the rest of the protein can come from milk, and it can come from legumes, chickpeas, and lobia, and a lot of things, other sources of protein, or even whole grains are good source of proteins as well. Talking about different diets, Dr. Nabila also mentioned in the previous presentation about the DASH diet and the Mediterranean diet. So I'll not go into the detail about that. Keto diet is in fashion for last couple of years, and people lose weight a lot with the keto diet. But we need to know what's the shortcoming in the keto diet. Keto diet has 70% saturated fat, like including the coconut oil and everything to add into the black coffee, adding butter into the black coffee. So it leads to dyslipidemia, and which can ultimately lead to heart disease, and it can just affect your lipid profile very badly. It can increase your LDL, it can decrease your HDL. So that's why it's not recommended. It's not recommended for weight loss, because ultimately it can lead to many other problems. On the other hand, if you want to have a low protein diet, it's a safer version is Atkins diet. Atkins has the same amount of fat that we regularly use, because among total fat should be less than 30% of the whole kilocalorie consumption per day. But the saturated fat should be less than 10%. So Atkins is a safer version because it has low protein. You start with 20 grams of carbohydrates per day. Then after 2 weeks, you move on to the 40 grams of carbohydrates per day. Then after further 2 weeks, it's 60 grams carbohydrates, and then 80 grams, and then normal grams of carbohydrates. It's a safer version if you want to practice low protein diet. Pakistani diet. It's
Ms. Naeem, may I ask you to please?
Okay, just give me.
Thank you so much.
Pakistani diet, I just want to say that has a lot of, typically it has a lot of oil on the top, and but it is highly modifiable. Many of my patients make it very rightly by making it in a small amount, like 1 teaspoon of oil. They make a very good palatable food. So it's modifiable diet. We can make it in low fat. Usually people ask me about the low salt or the right salt, which is potassium chloride. So we just know that diabetes and hypertension, it leads to compromised renal function as well. And hyperkalemia is a key factor. Use of ACE and ARBs while treating the hypertension, it can lead to hyperkalemia, and it can lead to life-threatening situations of arrhythmias as well. So it's not recommended for the persons with heart disease to use potassium chloride. We also see in market the pink salt, Himalayan salt, sea salt. There is very little difference of sodium content in the Himalayan salt, and rest of the salts are almost the same. So when people feel that it's safe, they use more amount. So it's just a good idea to use simple salt, but in limited amount as prescribed by AHA. Carbohydrate consistent diet, while preventing and treating diabetes, carbohydrate consistent diet is very important, because proteins and fats takes longer to digest and absorb. On the other hand, carbohydrates within 30 minutes to 2 hours, it start rising the blood sugar. So if you take the same amount of carbohydrate in 3 meals of the day, you can prevent not only hyperglycemia, but hypoglycemia. We all know that one bad episode of hypoglycemia, people stay in the fear, and the next few years stay in the hyperglycemia because they are fearful of the hypoglycemia. So by using the same amount of carbohydrates in the breakfast, lunch, and dinner, and your diabetes educator and your nutritionist can guide you that how much carbohydrates should be consumed by a person depending on their height, weight, and physical activity. So making sure that your diabetes, your blood pressure, and your lipid profile stay in the right range. And physical activity, Dr. Nabila has already mentioned very well. And recent guidelines 2025, 2020 International Physical Activity Guidelines 2020 to 2025 suggesting up to an hour of cardio exercise, cardio physical activity per day. So we should try. No, it's not only for adults or it's for women, everyone. And our ladies, women of the house, as Dr. Bilal was mentioning, their major role is basically in Pakistan, typically is like a housewife. So they have a major role by reducing, cutting down the fats and the saturated fat in the home cooked meal, so they can save their lives and their loved ones as well. So we should, I would conclude by saying that we should eat with our heart and mind. Our smart food choices will help us preventing all the family members of the house from the heart disease, hypertension, diabetes, renal, chronic kidney disease, and all the metabolic syndrome by making smart choices in their diet every day. Thank you.
Thank you for an excellent expose on the Pakistani diet and showing us practically how to improve our diets.
Thank you.
Our next speaker is Dr. Huma Nazir. She is BSPT, DPT, Senior Physiotherapist at the Rehabilitation Services at the Khan University Hospital, Karachi. Her topic is healthy heart lifestyle and exercise. Dr. Huma, please share your slides.
I'm unable to unmute myself. Can you hear me now?
Yes, we can hear you now.
Okay, thank you so much. First of all, let me introduce myself. I'm a physiotherapist from Khan University Hospital. Yes. Yes, here it is. Okay. Are you all
Dr.
able to see?
We can't see your entire slide. We can see half the slide.
Okay, let me.
आप इसको डाउनलोड कर लें, उसके बाद
Yes,
स्क्रीन
it is.
शेयर। जी।
Are you able to see my slides now?
Yes.
Okay, thank you so much, ma'am. I'm Huma Khan, Senior Physiotherapist from Khan University Hospital, and topic of my presentation today is heart healthy lifestyle and exercises. First of all, what the healthy lifestyle is. According to WHO, a healthy lifestyle is a way of living that lower the risk of being seriously ill or dying early, especially from disease like coronary heart disease and cancers, and because these are the things that can be avoided. So a healthy lifestyle is a way of living. So there are so many factors that help people to maintain healthy lifestyle. The one of them that I'm going to discuss here today is exercise. So what actually exercise is? Exercise is considered as a planned, structure, and purposeful physical activity. The goal of this activity is to increase your physical fitness. Yes, and there are different people do different types of exercises. Like some people go to gym, or they perform different exercises at home also. Exercise can be a walk in park also. A 30-minute of activity It should be a brisk walk, jogging, cycling, gardening, or 5 days a week. Anything that make you out of breath, a bit sweaty, or that increase your heart rate is considered as exercise. Now, here are some guidelines for exercise according to AHA. According to the guidelines, 150 minutes per week of moderate intensity exercises, aerobic activity is recommended, or vigorous activity. A combination of both, like intense and moderate and vigorous intensity aerobic activities are recommended. Spend less time in sitting and increase amount and intensity of your activities by gradually. This is the main point that I am going to emphasize on it, because if you start your exercises with high intensity and high amount from a beginning, so it make you overexertion, and you will overexert yourself. So to improve your endurance, it is necessary to increase amount and intensity of your exercises gradually by time. Now, what are the benefits of exercises? There are a lot of benefits of exercises. Some most common are cholesterol, that we all know that exercise help us to maintain to improve good cholesterol and decrease bad cholesterol. But not only the exercise, there will be a combination of eating, eating a balanced diet, quitting smoke, and reduce stress. Exercise also help us to control our weight, which is one of the major risk factor of coronary artery diseases. It helps to reduce pain, stress, depression, anxiety, and it helps to maintain our blood pressure also. These factors are already discussed by our earlier. So from where to start? If someone wants to start exercise or to enroll in any exercise program, so from where they have to start? The first of all, the main thing is assessment. There are some assessment tools which help us to evaluate the physical state of a person. Here is a first scale, that is BMI. It stands for Body Mass Index. This is a test to evaluate or diagnose a state of physical fitness. This calculator, called BMI calculator, is easily available on all gadgets like your smartphone, on Google, and everywhere. We just have to put our height in feet and inches and weight in pounds. So it gives you a calculation of your BMI. Here is a classification. A BMI less than 18.5 is classified as underweight. Between 19 and 25 is normal. 25 and 30 is overweight. 30 plus is obese, and 35 plus is morbidly obese. So on the basis of this classification, we can identify that person is actually where is standing and what goals they have to achieve. There is another tool that is called Borg scale. It is actually a rate of perceived exertion and is a way of measuring physical activity intensity level. Intensity level means how patient feel, how ones feel when they are performing any activity or exercises. In this scale, we ask a patient that how actually they are feeling. This scale ranges vary from 0 to 20. 0 to 9 is light, and then it's gradually increased like hard, very hard, moderate, and so on. So on the basis of this scale, we can identify the physical status of a person. Now, after assessment of a person through these tools, we can prescribe exercise to a person. There are mainly two types of exercises, aerobic and non-aerobic. What is the difference between them? Aerobic exercise in this body use oxygen, and it definitely increase your heart rate and your oxygen demand. While in anaerobic, there is a less use of oxygen. There are some exercises from which you can identify the difference in between. Aerobic exercises include brisk walking, swimming, running, cycling, jump rope, heavy cleaning, and gardening. while an anaerobic include weightlifting, isometric, interval training, and in sprints. Now, what are the recommendations? According to ACSM, the recommendations are that a healthy adult aged between 18 to 65 years should participate in moderate intensity aerobic physical activity for a minimum of 30 minutes on 5 days per week. And if they are doing any vigorous intense activity, so that should be of 20 minutes for 3 days a week. So we can identify that aerobic exercises are actually helpful for cardiac health or of a person. Now, what are the rules of aerobic exercises? There are some rules of doing these exercises that these exercises must be uninterrupted. That means there should not be any interval, and it covers large muscles group like legs and buttocks. The minimum duration will be between 12 and 20 minutes. And the most important is that during these activities, your heart rate should work at an intensity between 60 and 80% of its maximum capacity. Now, what are the benefits of exercise? Benefits of anaerobic and aerobic, both are here. Like aerobic exercises improve your heart strength, decrease your resting heart rate, your blood pressures, increase your endurance, your muscles endurance and capillary density, and decrease your body fat, while anaerobic increase your strength, your power, decrease your blood pressure, increase your endurance, and decrease your body fat. Here are another difference also you can see on chart that is that helps you to identify that a fuel source of anaerobic is glucose, while of aerobic is glucose and oxygen. In anaerobic, the energy used is 2 ATP molecules, while aerobic in 36 to 38 ATP molecules, that is much high. Byproduct of anaerobic is lactic acid, while of aerobic is CO2 and water. While heart rate of the maximum aerobic function of during anaerobic is above zone, while in if you are doing aerobic activity, it limits within the zone. Now,
Dr. Huma, may I ask you to start concluding?
Yes, these are some exercises like breast walking, yoga, running, aerobics, and swimming that all includes in your aerobic activity, and it improves your health. Now, impact of exercises on overall body. It impact your central nervous system. It improve your exercise. It give a good response in somatic and autonomic system. It impact on metabolism by increasing liver glucose output. It has a good impact on the skin also, like it increases sweat rate. Oxygen transport is increased, heart rate is increased, and impact on skeletal muscle by increase your ATP turnover. Now, exercise has also a very good effect on your balancing your hormones. It has like insulin and serotonin that helps to feel more relaxed and promote a good night's sleep. It reduces your body stress hormone, that is cortisol. And yes, it has exercise has a positive impact on fertility. During workout, your brain releases endorphin, which aids the production of hormones necessary for conceiving. Now, exercise is also benefit, have impact on thyroid, like regulate metabolism by keeping your glands healthy and help in stimulating thyroid glands. As these are some tracks by which you can track your activity, like fitness tracker and tracking apps. As Dr. Nabila has already shared, that person has to walk for 10,000 steps per day. So these are the trackers or apps that helps you to calculate how much activity or steps you have done per day. Now, I'm going to conclude my presentation on these two research that supports that suppose cardiac exercises like heart failure patients found aerobic exercises at 60 to 70% of heart rate reserve 3 to 5 times per week for over 3 years lead to improved health and overall quality of life. On other research shows that an individual who have a better health-related lifestyle gain a higher sense of life purpose and maintain, and they can, between healthy lifestyle and purpose in life may be a more efficient approach towards health. Thank you so much.
Thank you very much, Dr. Huma Nazir. for sharing with us how to maintain a healthy lifestyle and exercise for a healthy heart. Our next speaker is Dr. Nobia Ali. She is a certified instructor of American Heart Association and in charge Professional Skills Development Center, NICVD. Her topic is exercise to prevent heart disease. Exercise for people with heart disease. I'm sorry.
Right. Assalamu alaikum. Can you hear me?
Ji.
Okay. Assalamu alaikum. Thank you for inviting me on this forum. It's a great pleasure to talk with all of the Go Red members, especially the females, who gives a huge motivation to other females. So all the world is going towards the prevention of the heart diseases rather than the treatment. So being physically active is a major step towards good heart health. It's one of your most effective tools for strengthening the heart muscles, keeping your weight under control and warding off the artery damage from high cholesterol, blood pressure, or high sugar that can lead towards heart attack or stroke. To lower your risk, be active for longer than 10 minutes at a time. Try to do aerobic activity for an average of 40 minutes. Try to do this at least 3 or 4 times a week. Let me share with you the slides of mine. All right, can you see that?
We can see your slides. आप इसको slide show पे डाल दें.
Yeah. All right, so. All right, as you can see that this little summarization how to prevent a heart attack, to control your blood pressure, eat a healthy diet, get regular exercises, manage stresses, and avoid all your addictions. So according to the American Heart Association journals, recognition as many as 250,000 deaths per year in the United States can be attributed to a lack of regular exercises. Living sedentary lifestyle, which is very common in our societies nowadays, has consistently been one of the top 5 risk factors for heart disease, including the other factors like blood pressure, cholesterol, smoking, obesity. Those with low levels of physical fitness also experience a higher rate of CVDs like heart attack and deaths. Researchers found that heart attack patients who participated in a formal exercise program experienced a reduced death rate of 20 to 25%. Some studies showed an even higher rate of reduction. Several large reviews of past researchers also conclude that those patients who engage in exercise-based rehab after a heart attack are more likely to live longer. As you can see that this is the Russia in which 60% of the men who are addicted to smoking that contribute to a high rate of heart diseases. In China, there is a less or a decreased level of CVDs due to increased intake of vegetables. Indonesia having an improvement of socioeconomic state, so again, it's increase in the CVDs. Other things which you can see like rest of the world where the less developed countries who are having different multiple risk imbalances like malnutrition and addiction, certain addictions can lead towards higher cardiovascular rates. Okay, this is the last graph which was shared in 2021 by AHA, and that was the average daily death in the United States from COVID-19. Even in this COVID era, heart diseases were running the show and winning the title at that time. Second number was cancer. Third was COVID-19. So we have to move towards prevention as early as possible, and we have to change our lifestyle modifications. We have categorized 3 things: aerobic exercises, resistance, and stretching. So aerobic, what is this? Aerobic exercise improve your circulation, which result in lowered blood pressure and heart rate. It reduces the risk of type 2 diabetes, and if you already live with diabetes, helps you to control your blood glucose. Ideally, it should be done 30 minutes a day, at least 5 days a week. It includes, like, as you can see, brisk walking, running, swimming, cycling, playing tennis, jumping rope, heart pumping, aerobic exercises, the kind that doctors have in mind when they recommend at least 150 minutes per week of moderate activity. So this is another one, resistance training, which Dr. Nabila has already talked about, also known as strength work. Resistance training is a more specific effect on body composition, who are carrying a lot of body fat, like all of us, who is having belly fat and more prone towards heart disease. It can help reduces fat and create leaner muscle mass. Researchers shows that combination of aerobic exercises and resistance work may help HDL and lower LDL cholesterol. At least 2 non-consecutive days. It won't take much time. So it takes 2 non-consecutive days per week of resistance training is a good rule of thumb if you do it regularly, according to the American College of Sports Medicine. Working out with free weights such as hand weight, dumbbells, barbells, or weight machine with resistance bands, or through body resistance exercises like push-up, squats, or chin-ups, you can do it at your home also. Third is stretching, flexibility, and balance. This is more important, and this is what you can do it on routine. Flexibility workouts such as stretching don't directly contribute to the heart health. What they do is to benefit musculoskeletal muscles, which enables you to stay flexible and free from joint pains, cramping, and other muscular issues. Like after 40, everyone is having these kind of issues, especially females, when they are near to menopause. That flexibility is a critical part of being able to maintain aerobic exercises and resistance training every day, before and after every exercises, or and on routine basis. Your doctor can recommend basic stretches you can do at home, or you can find DVDs or YouTube. You can do even these yogas at home according to your doctor recommendation or fitness trainers. This is a balanced workout. This is not very much difficult to do at home, and it keeps your balance and flexibility for your normal routine, and stretches and flexibility can make you far away from the cramping, especially from your body. So there is no limit to the cardiovascular benefits of exercises. Researchers says any exercises, no matter how vigorous or for how long, benefit your heart health. Experts recommend people get between 150 to 300 minutes of physical activity per week. It gives a huge difference to your health. Exercises can be done in one long segment or broken up into several sections. It's not mandatory that you have to keep continue on the continue basis for 30 minutes or 15 minutes, but you can split it up. Exercise should be regarded as a tribute to the heart. We cannot give anything else to our heart, but your only limit is you, not anything else or not any recommendation. Thank you. Thanks for bearing me.
Thank you very much for finishing well on time and giving us an understanding of how to promote heart health using exercise. I will now, in the interest of time, we can probably only take 2 questions from our speakers. So my first question is for Dr. Ruth Kreber. And the question is, Dr. Ruth, if you're with us, the question, great, thank you. Thank you for your patience with us and for staying here throughout the sessions. So the question is that you talked about using smart apps, smartphones for heart health. So other than for rhythm, what other benefits can we get from the smart applications that you talked about? How can they inform patients, or how can they be used for self-management?
Great question. So in that review that I showed about when we looked at mHealth interventions versus control, and that meta-analysis where we looked at 16 randomized trials, what we found with that was that we could use these for being able to do more symptom management at home. So when patients were able to input their symptoms, once again, that's active data collection into their smart apps, that information could then be communicated with their healthcare teams to bridge that gap between the hospital and the home in that interclinical space, so that doctors have a better perspective of how patients are doing when they're in the home environment, rather than just seeing them intermittently in the hospital. So that's really where we saw the benefit. It was interesting though, in that meta-analysis, we did see the biggest benefit in terms of reduction of mortality and heart failure hospitalizations. And we really have more to do in terms of the development of our applications to be able to make it a little bit more seamless in terms of some of that, the self-care principles. We didn't actually see a difference in terms of self-care, but once again, that's not so much because of it's not valuable, it's more because our tools are still developing more to be able to measure those symptoms when patients are at home more effectively. So I would say that they're really great for heart rhythm, but they really can also be used for symptom monitoring as well.
So from my understanding from that answer is that we still need to develop these apps, and I suppose inputs from patients and physicians, basically all caregivers in the care continuum, will help to improve these apps and improve self-care of patients. So thank you very much. My next question is for Professor Nabila Soomro, my second question. And the question is that you talked about talking about healthy lifestyle and including it in the primary class curriculum. Could you talk a little bit about that, please, Dr. Nabila? Professor Nabila?
Is she around?
I think Dr. Nabila may be unable to unmute herself. So maybe we can ask a last question from Professor Aneza Niaz. And you talked about stress and how it affects heart disease. So what are your top 2 recommendations for managing stress?
I think first of all that I think we need to be very disciplined and make a timetable of every day. We must have a timetable, and we need to delete the things which we can do it the next day, so we don't all have to do everything on one day or pile things up. So all the we should have priority lists, number one. Number two, we must learn to delegate. I think the problem with mostly professional women, I find it very difficult to delegate because I'm very perfectionistic. And I think this is something, one of the greatest stress in professional women. We try to be perfectionistic in every way. So one is that. And of course, we've heard so much about exercise, etc. That helps. And for me personally, faith is the most important factor in dealing with any kind of stress. And saying prayers, I mean, that applies to any religion. Saying your prayers in Muslims, we pray 5 times. Even if you pray, I mean, I shouldn't say we should do that or you should do it, but even if you have one prayer and you really sit and pray, you don't have to, if you're very tired, you can sit and pray on a chair, for example. And praying is also is cleanliness. You have to do all the evolutions. You sit, you concentrate, and so all the thoughts go away. And then you also meditate. You talk to your creator directly, and sometimes emotions come out, and the tears which come out there in some ways make you feel closer. I find that this is something very, very important in my own personal journey. Prayers has been very, very helpful. And talking to friends, extremely important. Must have a social circle.
Thank you, Dr. Aneza. Thank you for explaining how to do better time management and manage stress. So now I'd like to invite our esteemed panelists to give a comment on the proceedings and share their comments regarding the healthy heart lifestyle. So may I request Dr. Amber Ashraf to say a few words?
Assalamu alaikum. Thank you very much, Sarah, to ask me for the comments. I am really grateful and congratulate Dr. Khalda Soomro and the team of the Go Red to organize such a nice symposium. And especially there were wonderful talks from all the speakers. I just want to have a small comments, especially Dr. Roth. The topic which you have discussed with us, it is the need of the day, the smartphones.
as each one of us have it, and why not to utilize this device for awareness sessions, especially in women's, regarding their health, regarding their preventive measures, and especially as Dr. Oneza highlighted, most of the women, they think they have to do each and everything, and they don't want to delegate these things to the juniors, to their other team members, because we all want to be a perfect ladies and we want to achieve everything 100%. And definitely we can utilize these smartphones and develop different apps in order to have a preventive measures, the awareness, and how to have a healthy food, a proper exercise to look after our comorbids, and to proceed further, and to spread this message to our juniors as well as the rest of the community members, and especially the far-flung areas where it is very difficult to go and communicate one-to-one, especially in this era of COVID-19. We have utilized this device for last 2 years, even the telemedicines, and as well as to treat the patients. So it is really a wonderful thing, Dr. Ruth, which you have shared with us. And especially Dr. Oneza, it is a topic, really the sadness and stress. We all should discipline our lives and stay away from this major risk factors, especially for women's and coronary artery disease or heart disease and the strokes, because we don't have a lot of our own studies and data, but whatever the small studies we have performed in our females, it's not only their physical health, the socioeconomic conditions, our cultural values, and the way of lifestyle which we have. As in the beginning, Dr. Bilal highlighted, the mothers are the journals of the home, and that's why they are producing a wonderful kids, and they are behind all the men who are performing very well, and especially we the women who are doing a job and leads the institutes. We are really in a very difficult situation, so why not we discipline our life, let the work to the rest of the juniors or develop the teams and delegate it so that we can discipline our lives. And the prayers, I think so, Professor Dr. Nusratara is here, and she always guides us how to have a close relation with your God and recite different surahs and all these things so that we can look after our stress. I don't want to take a lot of the time, but there was a wonderful talk from Dr. Nabila Sumro, especially regarding the diet and the young kids. Nowadays, we can see all of them are very obese. They are very lovely. They want to eat all the junk foods, the Coke, Pepsis, burgers and things, and all of them are just like a football, and especially in this last 2 years due to physical inactivity. If we just go and compare the pictures, or most of the kids, while they were having their online classes, they have developed this thing, but this is a high time. We must have to motivate them to go out and do some physical activity. The wonderful talk for healthy food by Dr. Tasneem and Dr. Huma has really motivated us to do exercise at least 30 minutes a day. If we can develop something at our professional places for the women to have at least 15 to 20 minutes exercise daily, it should not be our routine work, but it should be properly organized. And thank you, Dr. Nobia Ali. And really, we have enjoyed all these lectures from the speakers, and we try to communicate this message as far as we can with utilizing different modalities and more. Thank you very much.
Dr. Saira, can I comment here
Yes,
on Dr.
please. Yes, please. Go ahead, Dr.
Yes. Thank you. Thank you very much for this great opportunity. And thank you, Dr. Amber Ashraf, for actually very nicely summarizing the entire very, very informative seminar. I'm very, very impressed by the galaxy of talented and accomplished women that you managed to collect on this seminar. It's really interesting to see women going into all these different fields. I mean, going into medicine is very traditional, but to go into physical rehab, into psychiatry, into psychology, into, you know, into the details of little things, and to come up with this modern day, the digital age, basically, and that is the need of the hour, as Dr. Amber Ashraf also mentioned over here. I'd just like to make a couple of comments. One of them is on Bilal Muhyiddin's comments, which is very nice of him to be part of the GoRed and to be supportive. But I think that, yes, mothers, they don't just bring up sons, remember, they bring up women. They bring up daughters as well, who stand side by side with the son. So that is the need of the hour. Please, this is what the GoRed movement is all about. Right? It's not the sons that the mothers are bringing up. It's the daughters that the mothers are bringing up. The sons are also there. They have always been there, right? But they go side by side, and that is what we really need to emphasize on in our movements, that we are actually the gender bias that has always been there in the management and treatment of women and their heart diseases must be taken away. And all the women who are pitching in, are they looking after their own health as well? We as women sitting here on this platform, look at, are we able to manage our stress and anxiety? I think, and I think Dr. Sohail Aziz wants to comment on the stress and anxiety issue as well, that professional women suffer from far more stress and anxiety than do men, because men have already been there in that field for millennia. But women are competing. And as I've always said, the women who come up onto the top are probably 10 times smarter than an average man, and 10 times has had to work 10 times harder to be there because of what our social and cultural setup is like. I have had to experience, you know, that when I do a ward round, when I was younger and looked much younger, today age and, you know, white hair and everything, that has a very good effect on patients. But when you are younger in your 30s, and smart, like all these young ladies that I see over here, it's not easy for patients to take you seriously. So they will look at your younger colleague who's a male house officer and look into their eyes and corroborate whatever you are saying, right? So it's very hard in this atmosphere to make a dent on, and it creates a lot of anxiety in women. And they want to go home and be the perfect wife and the perfect mother and the perfect running of the house, socially, everything. And so they are actually working full-time, 24 hours every day. And they need stress and anxiety management. It's not easy to say, stay away from depression, but it's the anxiety and stress management that they need to do. And physical exercise. We talk about it, and we've talked about it 6 different lectures, that this is what we do. Does anyone on this forum do it? If they do, you have to look inside to do that. Yes. So I got 1 hands up here, but no more than that. So that those are all points of reflection that we sitting here on this professional platform should also be looking at as we convey our messages to the rest of the community. And then once again, thank you so much for all the information that you've passed on and for organizing this excellent seminar. Thank you.
Thank you very much for your comments, Dr. Amber. I believe Professor General Sohail Aziz wants to make his comment on stress. So, sir, please go ahead. Maybe we'll request sir to give his comment at the end. Professor Zainab Samad,
yes, I think I've been able to unmute myself.
Okay, sir, please go
yes,
ahead.
I did manage to unmute myself. I think there's been some wonderful lectures, and I've really learned a lot from what's been said, and it's been very educational for me. To me, in my clinical practice, it's very easy to guide people on diet, exercise, and so on and so forth. And like we just heard, that stress management is a really important issue, and many people are not able to cope with it. So there's some tips which you can probably give. For example, if your son's had an episode, or God forbid somebody else had an episode, well, how could you not be stressed? So there's some stresses which you can't avoid, and you need to accept them, and healing will happen with time. But few tips which help in stress management is not to overcommit for yourself. Like appointments should be spaced. You need to leave well in time for wherever you want to go. Have gaps in between, because if you're short of time and overcommitting, then you naturally will get stressed. The other thing is an ability to have an assertive conversation. This especially is important for families. Either you get in the mode of saying, yes, I will do it, or you say, no, I will not do it. And the other is assertive conversation, where you discuss with what are your limitations, why you should do it, why you should not do it. Because unless you do this assertive conversation, your pent up energy for constantly saying yes or no will build up. And when you get a chance for any opportunity, you will explode, and that will be the start of a very stressful relationship in every society. The other thing which you need to have is an emotional health, which needs to be, by that I mean, you need to have an appropriate emotional response to any emotional situation. I find that people who get angry, मैं गलत बात बर्दाश्त नहीं कर सकता. Well, अगर जो गलत नहीं कर सकता तो अच्छी बात तो सब बर्दाश्त कर लेते हैं. The trick is to accept that गलत बात, or whatever you think is a गलत बात, and that's where the assertive conversation comes in. So you should be having self-discipline in life, like we heard earlier. Life has to be disciplined. You need to space things in between. You also need to slow down. These are tips which I tend to give to my patients in order to help them cope with stress. And silence really doesn't help. You don't have to respond to everything which comes your way. Jaise har bahar jati ball pe, balla nahi ghumana. You're gonna get out. What really hurts people is not the sadness or depression. Of course, the association, but remember, there's a lot of sadness and depression in the Second World War. But in those times, these sort of heart disease and diabetes was the least. So it's not just, it's a very tricky question what the psychology has to do with health. But it's the explosive emotions which are really harmful for heart. And that's something which you really need to do. And I think there are people who say that lack of sleep rather, is also a new smoking. So and sitting, of course, a new smoking. So you need to sleep enough. And then you got to train yourself how to let go of these negative emotions. You can really train yourself, because if you start finding faults in people and start getting angry, you'll find a reason to get angry at anything which ordinary people do not. So those are my few bits which I thought I must contribute, because stress counseling is a very important part of a cardiologist, and he needs to be able to do it. And these are some of the things which I came across. So thank you very much for a wonderful session and allowing me to share my comments. Grateful. Thank you very much.
Thank you very much. Professor Zainab Samad, one of our esteemed chairpersons, would you like to give your comments, please?
Thank you, Dr. Bukhari. So I just want to congratulate Dr. Khalda Sumro for an excellent program and her leadership of this initiative. And Dr. Saira Bukhari for excellent moderation and trying to keep everybody on time here. I do want to make a few comments. I think the program was really comprehensive in terms of really touching on the risk factors that are shared not only by cardiovascular disease, but several other non-communicable diseases that are rising in Pakistan and are particularly pertinent to women. It turns out that physical activity is actually very low amongst Pakistani women. Most of the physical activity that happens in Pakistan is work-related, and a lot of women end up not going to work, and that physical activity does not happen. So I think the very fabulous speakers all shared tips on how to improve risk and reduce cardiovascular disease risk, both in a primary and a secondary fashion through physical activity as well as diet measures. I do want to point out, and I'm a big fan of mHealth interventions, digital interventions. I really believe that everybody is stuck to their phone, and how do we get people to into people's brains the correct knowledge through their phones. So there's a knowledge gap at the public level, and then there is always an implementation gap. So you know what needs to be done, but you don't do it. So for both of those things, digital interventions are really crucial. But in Pakistan, there is a very big gender divide as far as digital access is concerned. We kind of land fairly low on the Inclusive Internet Index. There's a gender gap in internet access, which is about 65%, and a gender gap in mobile access, which is about 51%. And so that's something that the government and other policymakers need to really work on for it to prove to be a good tool in our efforts to combat cardiovascular disease for both women and men. And the last thing I want to point out is that, cardiovascular disease is the leading cause of death amongst both men and women. Yet we see a fair amount of inequity in terms of the trainee workforce as far as women and men is concerned, and also in terms of governance of organizations that are primarily involved around cardiac disease advocacy. So we really need to be moving towards a more equitable distribution of building capacity as well as leadership in our treatment, management, and training for cardiovascular disease. Thank you very much.
Thank you, Dr. Zainab, for speaking about the disparities that exist in our society. I'd now like to invite our very own Professor Khalda Sumro, who is the coordinator for the Go Red for Women, to give her precious comments.
Dr. Khalda, please unmute yourself.
Up.
Yes, madam, we can hear you.
So this was really excellent session, and I'm proud of you, Saira. Because of you, this session was managed very well and timely. So I will not go through the details of the lectures, but it was collectively the speakers, the chairs, what they told us was thought-provoking. If we see in our urban areas, yes, we can implement we can work on the smartphone and the smart heart, because we know that we can use it in telemedicine. Way of treatment, by even regarding the blood pressure, pulse rate, ECG, monitor, and everything we can do through this smartphone. But we must keep this thing in our mind, that it is blessing that our urban area people are adopting the lifestyle which is really healthy. They are exercising, they are taking vegetables and low salt, everything. We need this system of smartphone in our urban area, but that doesn't mean that we have to not create awareness in our urban areas. Women's, as Zainab Samad said, that women's and gents, we have some difference, and that is because of the socio-cultural values of the two different regions, that is the peripheral areas and the urban areas. Our urban areas have more stress, our urban areas has the dual burden of the work at home, offices, and the less time to exercise and junk food. These areas we must address and create awareness in the rural areas. What we have learned from this symposium, we have to spread this knowledge to our rural areas doctors so that they can convince their patients to adopt a healthy lifestyle. Thank you so much, all the speakers and chairpersons, our President, Pakistan Cardiac Society, and General Secretary Bilal Muhyiddin. Thank you.
Thank you. I'd now like to invite Dr. Huma Tareen for her comment.
Very informative session, and I'm actually impressed by the selection of topics because American Heart Association is now focusing more on primordial prevention. While primary prevention was treatment of risk factors to prevent development of cardiovascular disease, primordial prevention is avoidance of development of risk factors in the first place. And this can only be possible if we cultivate good habits in our kids right from school age. And of course, importance of exercise, healthy lifestyle, healthy diet, and avoidance of stress cannot be underestimated. Each and every topic was well elaborated by our presenters. And at the end, I would like to congratulate to Dr. Khalda Sumbu, BODED and Pakistan Cardiac Society for organizing such an informative session. Thank you so much.
Thank you. Thank you very much for your crisp comments. I would now like to invite Professor Bilal Muhyiddin, General Secretary of the Pakistan Cardiac Society and Professor of Cardiology at King Edward Medical University, to deliver his concluding remarks and vote of thanks.
I think Dr. Bilal is not available here. He has some sort of assignment and he left.
So that
this job should be Saira, you take this job.
Okay, thank you, madam. I thought I would ask you to do it, but thank you very much for this job. And so with that, I would like to thank all our chairpersons, our esteemed speakers, for coming, for talking about a variety of topics that touch healthy heart and healthy heart lifestyle. And we would look forward to using this knowledge that we have gained to implement it, like Dr. Khalda rightly mentioned, in both urban and rural areas, and basically promote healthy heart in all our patients and in our population. Thank you very much.
Thank you to all of you.
Yes, thank you very much. Thank you for a lovely seminar.
Thank you. Thank you.
And Dr. Ruth, yes, we will stay connected on Twitter. Thank you very much for your comment.
Thank you so much for inviting me.
Thank you.
Thank you so much.
Thank you so